Hi, my name is Casey Villaresis, and I will be presenting a case analysis on the Dale Morris and the New York State measles outbreak. So, step one, gather background information. Measles is a highly contagious virus. The virus can be spread to other people by sneezing and coughing. According to the CDC, measles is so contagious that 90% of the people who come into contact with someone who is infected will also become infected. Measles is one of the leading causes of death among children. In May 1982, two counties in New York State, which were Dutchess and Ulster, experienced outbreaks of measles among school children. Dr. Dale Morris, who worked for the New York State Department of Health, and a multidisciplinary team investigated the outbreaks. They found that the population affected had been previously vaccinated. Step 2, analyze the current situation. So Dale Morris and his team needed to continue researching the outbreaks in order to understand the reason the measles vaccination was no longer effective. One strength was action was taken in order to vaccinate and stop the spread of measles. A weakness was there are vaccine exemptions that hinder the goal of stopping the spread of the disease. An opportunity is it creates a framework for other countries to tackle diseases and vaccinations. A threat is that people traveling into the United States import measles and start outbreaks. The mission of the New York State Department of Health is to promote the health and productivity as well as improve and protect the health of all New Yorkers. They carried out the goal of eliminating the outbreaks of measles in schools. Step 3, prioritize core issues. The root cause of the outbreaks in New York was the current vaccine was not effective and the measles spread easily through the population of school-age children. In New York, there were outbreaks of measles in 21 schools, high school, and colleges. There were 91 cases and there were 53,000 doses of the vaccine that were given that costed the state $859,000. The cost did not include the resources used to treat the patients who had the disease. Step 4, analyze alternatives. Dr. Morris researched and analyzed the outbreak of measles and found that a second dose was needed to significantly better measles immunity. The Health Commissioner of New York, Dr. David Axelrod, used the information given by Dr. Morris and a panel of experts in order to convince the New York legislature to implement a mandatory second dose policy. The vaccine was added as a school entrance requirement. So the health belief model can be applied to this case. So on the interpersonal level, positive beliefs towards the vaccine will promote its use. And on the community level, presence of disease in community will encourage prevention and use of vaccines. So the first alternative is to educate individuals about vaccines to increase vaccine uptake. And the second alternative is for healthcare providers to emphasize the child benefits to encourage vaccination. Step 5, recommendations. So one recommendation implemented in the case was to vaccinate children with the required 2-dose and continue to enforce the vaccine as a school entrance requirement. The second recommendation would be to increase surveillance on the importation of the disease coming into the United States. By responding quickly to the outbreak, the disease can still be contained. Step 6, establish action plan. In May 1989, Dr. David Axelrod presented the findings of Dr. Dale Morris to a panel of experts to decide the next steps to take action against the measles outbreak. The panel decided to adopt the 2-dose policy, and Dr. Axelrod presented all of the information from the panel to the New York legislature. In June 1989, the New York legislature enacted a law that required kindergartners and first-time college students to have 2 doses of the vaccine before entering school. In August 1990, the requirement went into full effect as the state gave the people time to get vaccinated. Step 7, opinion. So, my opinion is that policies are crucial in promoting the health of the population, and cases like Dale Moore's and the New York measles outbreak show how surveillance and epidemiology are essential in establishing public policy. More vaccines should be added to the list of mandatory vaccines, but until then, we can apply the social ecological model to increase vaccine uptake. And that was all. Thank you for watching.